I surfed all the big wave tours, chasing the biggest, baddest things you ever seen Mother Nature throw at you.
There's probably only 25 people on the planet that are capable of riding waves of this magnitude. His claim to fame for the outside world is that he caught one of the world's biggest waves.
It looked like the whole ocean had stood up all at one time.
He was 17, and it really just changed his life.
Makua surfs the largest waves in the world. The difference between life and death is often falling or not falling on a wave.
How were the waves when you were back home?
Oh, we had pipeline like as good as it gets.
Are you serious?
2 days, yeah. I'm supposed to have no nasal surgery since I was a kid. I was telling you, yeah, and you'll probably find some stuff in there that you probably never seen, you know.
One of Makua's symptoms has been some instability or just imbalance.
This poor guy just needs so much help. And Makua, it's amazing to see kind of what your poor nose has been through, my friend. The procedure Makua is going to have is balloon sinuplasty.
I'm excited to take care of you.
Basically open up the nasal and breathing passages and get him back to functioning normal again.
Otherwise, I'll see you sharp at 7.
Right on,
All right,
thank
brother.
you,
Be well. Have a great day.
Thank you.
Aloha to you, man. Take care.
He has been, as a young kid, rushed to the hospital several times, having episodes of sinus attacks. There you go, that's opening up.
I was in the hospital, 9 months out of the year, basically breathing out of straw my whole life.
Most people that have had trouble, as long as Makua, their baseline has shifted. I mean, they really don't remember what it feels like to breathe normally.
Just being a little kid, not being able to breathe, going, I'm gonna make this.
1, 2.
And I'm making sure that he stays in the best shape of his life, because his life will be in danger anytime he's out there.
You know, you hit and all your air's out, and you still have to stay on there. You don't have a referee, you don't have a medic. Every other sport in the world, if something goes wrong, someone's there. Whoa, pause, time out. Surfing, there's no time out.
This morning what we're going to do is we're going to utilize balloon sinuplasty technology with minimally invasive techniques. Basically for the patient, what it means is we don't have to cut that soft, very sensitive tissue, and because of that we have less bleeding, less pain, faster recoveries, all the good stuff.
Dr. Weeks is doing a septoplasty bilateral resection, maxillary osteotoma, bilateral submucosal resection, and bilateral nasal endoscopy with sinus lavage. He's going to fix your nose.
This is a purely outpatient procedure. He comes in the morning, and before lunch he'll be home and in his own bed. He's not going to be debilitated in any way.
Yeah.
Ready to fix you up.
There you go.
All right, buddy. Well, listen, we're going to take good care of you, treat everyone like family. And, surgical treatment can cure a problem in a matter of an hour and really completely turn somebody's life around. So this is really, at the end of the day, why I'm a surgeon and why I do what I do.
Unfortunately, Makua's broken his nose probably 5 times. He's been hit in the face with surfboards. Just a really disrupted airway on both sides. On a scale of 1 to 10, his would be a 9.9.
Instead of using instruments that cut and remove bone, we're using an instrument that we place inside of a block passage and dilate. It's very similar, to cardiac angioplasty.
Everything that's there has a purpose, and if you don't have to remove things that are made to be there, that's better for the patient. House lights off, please.
And the reason the technology works is we're dealing with very, very thin, paper-thin bone, and the balloon is a very high-pressure device.
Okay, I'll take the maxillary balloon.
That balloon, when it's inflated, it will microfracture that bone.
And then it will heal in that open position. So what I'm going to do now is look down on his cheek. You can see that light moving in his face. There's no doubt that I'm in the right position within his sinus. Okay, so now we're going to gently inflate the balloon. 2, 4. Beautiful, that's great. To me, that picture right there is the essence of balloon dilation. There's absolutely zero bleeding. So we've done one side, and we'll go ahead and get ready to treat his other side. He will be good to go.
To me, the art of medicine is connecting with the patient on a personal level. I mean, there's no question that outcomes are better when patients trust and when patients feel an emotional connection. I just want to tell you everything went perfect, buddy, okay? Could not have been better.
I have one day.
You got one day, and they'll be like a new person tomorrow, okay? All right, my brother.
Take a deep breath. Exactly. All right, I'll see you next week, all right?
All right.
Air's hitting places that it's never hit before.
Yeah, it feels like all tingly.
It's like, you can't believe it. You're healing beautifully, my friend. Absolutely
Thank you.
beautifully. No limitations. All right. Back in the water, everything. Surf today if he wants.
Perfect.
This is the standard of care now in sinus surgery.
Amazing.
So,
Life-changing, Doc. Life-changing. Thank you so much. It's a whole new world now.